Hey guys, so I am still in the process of my big research topic that I'm going to split into two pieces, but it's still taking a lot of work because it's a lot of me drilling down and reading all this scientific research. But I still wanted to do a video for the weekend, so I'm going to do two parts. That way you can pick or choose whichever one you want to watch. The first one is going to be geared more towards brain aneurysm, and then the second one is just more personally how I feel like I'm doing at this point. So, whatever you choose to watch, that you feel that's going to be of benefit, great. If you want to watch both of them, that's wonderful. But this video in particular is going to be about brain aneurysms. So obviously it's a lot of information, and so I'm going to be looking down at my computer to read this information. So the reason why I feel this is important is I don't feel that brain aneurysm awareness is really at the forefront, or not a lot of people are aware of it. And I know that there's a lot of people trying their best to get the message out, and they're doing a great job. But I feel like there's power in numbers of more people trying to push that narrative out of what can we do and where do we begin to start educating on risk factors for brain aneurysms. And I'll go into detail about that towards the end of what I think should happen. So, but here's some stats first. So, 6.5 million people in the United States have an unruptured aneurysm, which is not, high level risk. 30,000 people in the United States have a ruptured aneurysm every 18 minutes, and that's alarming. At first, when I saw 30,000, I was like, that's not bad for the population. I mean, it's still a lot, but that's not bad. And then I saw every 18 minutes, and that kind of shocked me. So, women are more prone than men, of course. Women over the age of 55 have a higher risk, and I go into detail about that. I go into detail about the reasons why here in a moment. African Americans and Hispanics are twice as likely than whites. 500,000 deaths worldwide have with half victims under the age of 50. There's a 50% fatal percentage for ruptured brain aneurysms. And then of those who do survive, 66 have neurodeficits. So I am the 34% that survived a ruptured aneurysm without a neurodeficit. 15% of people with ruptured aneurysms die before reaching the hospital. And I have my thoughts on that, but I just want to get through these statistics first. It's more prevalent in people 35 to 60, which is when we all start falling apart. Ruptured aneurysms account for 3 to 5% of all new strokes. So mine was a SAH stroke. 1 in 100 ER patients who complain of a headache end up with a ruptured aneurysm. And I know I've touched on this subject multiple times, that they treated me like I was having a migraine. So I had to fight for my CT scan. That's why you gotta advocate if you're having, when I go through the symptoms, that you say, this is not a headache, I need a CT scan, because that time lapse between them treating you as a patient with a headache or a migraine versus getting a CT scan to rule out a aneurysm, I mean, that's life or death, and that's in minutes, that's not hours, so it's very critical. 20% of people diagnosed with a brain aneurysm have more than one, and that is what like gives me this dreaded fear constantly. Like, I think that's what haunts me. I have said that, like, I'm haunted by certain stuff, and it's like that number there, like, I'm afraid I'm gonna have it again. And I mean, it's only 20% of people, and more than likely it won't happen again to me, but just to know that there is the possibility, that scares me. But as my neurosurgeon said, you right now have the same risk as anyone else out there. So the sad part here is the federal government only spends $2.08 per year on brain aneurysm research for each person afflicted. That's real great. I know that they spend a ton of money on researching a lot of crap that has no significance in our daily lives. If you Google all the research, the grants that have been given by the federal government for just the United States, and look at what the research is, it's like, it's comical that how on earth did they get that approved. So maybe like we need to contact these people, like, what did you do? Who did you talk to get that in motion? Because this is like a health problem, and $2.08 per person, it's not a lot. And just to reference, the statistics are from the Brain Aneurysm Foundation website if you want to look at that further. So they go into causes and risk factors. So I kind of go off of the Brain Aneurysm Foundation website, but I want it to look at like why. So I kind of go back and forth on where I got my information. So, you know, obviously they develop silently. I mean, you don't know that you're developing them. Some inherit weak blood vessels. I mean, it's just a congenital type issue that they were born that way, so they have that higher risk. Family history, which is the one that I'm deep diving into, is one that they're really doing a lot more research and trying to find the correlation of like the relationship. Like, is it, you know, skip a generation? is it, like female to female, and did it happen at a certain age at the same time? So they're doing a lot of information on that. The next one is smoking, which smoking causes everything known to man. So, but the reason why is, first of all, the American Academy of Neurology said they admitted that the relationship remains unknown. So they don't exactly have a reason for it. But WebMD, who for some reason, I just don't really trust their website so much, but I mean, they made a little more sense. Because when you smoke, your brain blood vessels develop multiple aneurysms or weak spots from smoking. Something happens to your blood vessels. So, and then those weak spots eventually end up rupturing the more you're smoking. Hypertension, that's a pretty good one. The NHS says high blood pressure can place increased pressure on the walls of the blood pressure or blood vessels. I'm so used to saying blood pressure. Age, over 40. So as we get older, we fall apart. So the NHS says that the walls of the blood vessels are weakened over time by constant pressure of blood flowing through time. So, that's just, as we get older, we fall apart. Gender, women, the reason why they are more prone to this is because they have a hormone that causes the weakened blood vessels, and usually this hormone is during like menopause, which is why like women over like, I would say like 50, when you hit menopause age or what, that's why they're more at a high risk. Race, that was interesting for me because, they talked about African Americans and Hispanics had a higher risk. So I started researching and I was like, why is that? And so the Los Angeles Centennial was like the only article where they kind of throw it out, and I mean, I agree with them. It's a gap in awareness, medical help, in some communities, lack of insurance, or they just don't seek help in time because they don't have that awareness. So I believe that, and it's also with like overall health, like nutrition and so forth, because hypertension and diabetes, are a huge factor, and diabetes not so much with ruptured brain aneurysm, but that's something that needs to be really thrown in there to make awareness for the African American community and Hispanics, to get them aware and to seek help. I mean, if you go to the ER, they're not going to turn you away, and I know that finances are like a lot of people don't go to the ER because they don't want that financial burden, and that can be from poor to middle class. You don't want that medical debt, but I mean, they're not going to turn you away. you can make payment plans, or, you know, I don't know, but it's far better to save your life than worry about a medical bill. I mean, worry about that later. But I get it. I mean, I've done that before where I've like waited till the last minute to seek medical advice because I'm like, I do not want a hospital bill, or do not call an ambulance because a 2-minute ride is like $900. So I get it. But, you know, I do believe that that's something that needs to be addressed. And gotta find a way. Other disorders, presence of arteriovenous malformation, congenital abnormality of the artery wall, which is kind of what I said earlier. Drug use, cocaine is the number one, because it can inflame the walls of the blood vessels and raise your blood pressure. Excessive alcohol use. So when I was looking at that one, it wasn't like clear cut on that one like the other ones. So I went to the stroke organization from the UK, and so in their research, they're not really saying so much that alcohol is directly a cause for a ruptured aneurysm, but excessive alcohol leads to medical issues, and those medical issues will be the contributing factor to being a high risk for ruptured aneurysm. So, and then infection from the NIH sometimes can affect arteries of the brain. The infection weakens the artery wall, causing the bulging aneurysm to form. And then severe head trauma, obviously blood vessels can be damaged. So, ruptured and unruptured. Going over the basics with ruptured. Ruptured, that is an immediate response. That is 911, seek medical help as soon as possible. Because when it ruptures, the blood in the from the aneurysm goes in the spinal fluid space surrounding the brain, which is SAH, which is what I had. And although it lasts for a few seconds, it can result into more issues. It can damage brain cells, cause vasospasms, reducing blood flow to vital organs, to the brain. I remember I took so much medication for vasospasms. Stroke, which I had to, hydrocephalus, which I had to. So, signs and symptoms of a ruptured brain aneurysm. So, I feel like they kind of need to enhance the signs and symptoms to kind of make it a little more alarming. And I believe I've said this before in one of my videos. So obviously we know sudden and severe headache, often described as the worst headache of my life. Now, I mean, a lot of us get like really bad headaches, and you wonder like, what is the worst headache of your life? Because I had migraines, and I'd be like, God, this is like the worst migraine I have ever had. Like, it's debilitating. So I was always like, should I be concerned? I mean, you know, and then when you Google it, it's like worst headache of your life, and you're like, I don't know. I feel like there needs to be more descriptors. So for me, it was a rubber band snap, and other people have echoed that same thing, that it feels like a rubber band just snapped on the back of your head. And I mean, because I've read about that, that's why I knew immediately, like, oh, we're having a ruptured brain aneurysm here. So nausea and vomiting, I feel that's so light. Nausea and vomiting, like, oh, I'm a little queasy and throwing up a little bit. Like, I was projectile vomiting, crawling to the bathroom, projectile vomiting. Did it when I was in the ambulance, did it in the hospital. It was projectile vomiting. A little more alarming, a little more triggering, right? Than just nausea and vomiting. Stiff neck. That's okay, stiff neck. I don't think they need to enhance that anymore. I felt the stiff neck as soon as the rubber band snapped. Blurred or double vision. I didn't have double vision. My vision did start to blur by the time the EMTs came. Sensitivity to light. You know, that's kind of a hard one. I've touched on how much I hate like office lights and hospital lights. I mean, it's not a nice glow at all. Like it's sterile. It's ugh. So yeah, the hospital lights were bothering me. So I did have sensitivity to lights. Seizure, I did not have a seizure. Drooping eyelid, I don't know if I did. Dilated pupils, my pupils were dilated. Pain above and behind the eye, yes. Right behind my left eye, near the area where I get my migraines, which they keep refuting that they don't correlate with each other. That was where the aneurysm ruptured. Loss of consciousness. Thank God, like my fight or flight mode went on, because I didn't lose consciousness until they transported me to the neuro unit downtown at the other hospital that specializes in this. Because I just vaguely remember a few things, and then I was out, and the next moment I woke up and had doctors over me, and it was like the next day. And weakness and numbness, yes, I felt weak, like initially when it happened, like when I was crawling on the floor, I felt weak, but then that adrenaline popped in, and then it was like I shot right up, and then I immediately went downstairs to wait by the door, because I thought that would be too much time for the EMTs to get the gurney all the way up. I was like, time saver, I'm like going down. So unruptured aneurysms, you know, pretty benign. Usually there's no symptoms. Generally you don't even know about it. It's kind of an incidental like finding when, you know, doing a scan for something else, they come across it. I think really the only time it becomes an issue is if it does become large and it starts pressing on the nerves. It can cause symptoms, and then it kind of echoes what the ruptured aneurysm is, but it's a little less. It's more like the blurred double vision, drooping eyelid, dilated pupil, pain above one eye, weakness or numbness. So but you know, it's not as critical as, I mean, it's something you gotta be vigilant and keep watch on, but you know, it's not compared to a ruptured aneurysm. So time is everything. Time. I feel like I read more that ruptured aneurysms happen at night, and most people are asleep, so I don't think that they don't get a chance to react, or they're just like, I'll sleep this off, because there's just not enough awareness about it at all. So from the Brain Stroke Foundation, there were common questions that people ask, and general ones. When will I get better? There's no time frame whatsoever on when you're going to get better. I mean, it just depends on the damage that was done, the neurodeficits, how much work you put in to help yourself. I mean, you have to work at it, and then not only that, but you're gonna go through several setbacks, and a lot of people, when they have their setback, they feel defeated and feel like, well, I'm never gonna get better, and it's like, that's part of the process of healing, is you're gonna have a lot of setbacks. It's just like injuring your leg and having like knee surgery, and you're doing rehab, and like one moment you're walking fine, the next day in rehab, like you're like struggling to walk, and you're like, God, I'm getting worse, and it's just a setback, and like the next day or next week it's gonna get better. So I think finding acceptance that there's gonna be setbacks will help, and keeping a positive mindset about it too, which is very hard. I mean, it's easy for it to be said, like have a positive attitude about it. When you hear it from doctors, you're like, have you had one? So you don't know. But as someone who has gone through it, it is a struggle. Like, I mean, yeah, it's really hard to like stay positive all the time when you have setbacks, because it's like, I thought I was getting so far, and now I'm like falling behind. So keep those in mind. Why am I so tired was another big question, and I'm so glad that was the second question that most people ask, because I fight this every single day of my life. So they said it's very common, very, very common. Every single one of us are gonna have fatigue, and a lot of people say it has a significant impact on their life. I mean, their quality of life has changed. Their energy levels are low. Sometimes it interferes with work. Some people lose their jobs. It can destroy a relationship, friendships. There's just a lot that can happen with it. So, and it's just because I don't think that like the other side understands what's going on with your brain and why you're fatigued, which is why they have support groups for like caretakers and so forth. But I think like employers should take that too. My company's just fine. They get it, they understand. But there could be other companies out there that don't get it, and I mean, legally, really, they can't do anything, but what was intriguing to me was they said that fatigue is actually very necessary for your recovery process. And, I'm like, that does make sense. Like, it clicked to me that while it sucks that I'm going through a lot of fatigue, that's actually a good thing. That means that my brain is busy repairing itself, like all the networks to repair. So while I'm like, okay, I'm gonna take like a nap, like that's a good thing. It means that my brain is repairing because, like, I've utilized it. So, but they are doing more research on stroke fatigue and ruptured aneurysm fatigue. The next one, the third largest question asked is, why am I depressed? Well, I mean, you had like a major life event happen to you, and you have to process like this whole new life. Life is not what it was before this happened. I've said this many times, and I've written about this, that like the Wendy on January 28th during the day, that person died that night. A part of me died. And like I'm never gonna be that same Wendy anymore. Like I have all the same, I wrote my last blog, like I laugh, I joke, sarcasm, I'm still like the same Wendy, but it's just my outlook is different and how I process things is different. And I'm not looking at it as a negative, I'm looking at it as a positive. In the beginning stages, I wasn't looking at it as a positive. So it's just something you have to work through. It's coping. And, the number one thing is to seek help. And I highly suggest that. I mean, a lot of people choose to handle it on their own, or they're afraid to seek help, or they don't know who to contact. I am a huge advocate for mental health, and because I feel like there should be no shame in experiencing everything, because we all do. Every single one of us has some type of mood or life change, or something happen, and you're in denial if you say that, no, I've never experienced anything. So maybe you can keep yours at bay, that you don't require to seek help and you have coping mechanisms, which is fine. But trust me, there will be a time in your life that something catastrophic will happen, that you will need to seek someone's help to guide you. And it doesn't even have to be big. I mean, these, a psychiatrist can help prescribe medication, and it doesn't have to be long term. It's just to like even you out, so that way you can start processing your everything that's going on, instead of being so like erratic or so low. The medication gets you stable, so that way you can start processing the information. and then they can talk to you, and then, a psychologist or a therapist is, they're more geared towards like, uh, this is how I feel, and then feedback. And there's different types of psychologists and what, strategies they offer. And don't be discouraged if you find that one doesn't work for you. It's not all, everyone has a different technique, and it's like, just, you have to shop. You have to find the right fit. So thankfully I have a psychiatrist that I see for, because I have post-traumatic stress disorder over this. So I was lucky that my first try I got bingo. So he's very good. But it's necessary because I have to, like, get it out. So, and I'm very into cognitive behavior therapy, and I know how to do it myself, after going through it by a professional, of course. So I do know, like, methods to try. So the Brain Aneurysm Foundation said that they had collected $3.5 million in grant awards since 2007. And to me, that just seems like such a awful number. Like, the number needs to go up. So I've been thinking about this, and I'm like, we need to campaign more. And all the foundations, all of them are like, we need your help. I mean, it's everywhere on, please, they're all asking for our help to push to get the money needed to do more research, to potentially save someone's life. Are there, different things that can be done? I mean, it's just like, there's so many W's of investigating on a ruptured aneurysm. So, these foundations out there, they're doing their best to collect grants, and, people donating money. But, it's pretty sad that, when you go to the website, people are like, please help, get the word out so that way they can further their studies. So that's just something that concerns me, and I'm like, I don't know what more to do. So I wrote a letter to my senator about it, and so they said that they were interested in listening to what I had to say. So I need to draft something. Is it gonna help? I really don't know. I mean, who knows? But I won't stop. I'll go to the next person, and then the next person. So